Hello, I'm Dr. Pak. I'm a chiropractor over here in Morrow, Georgia. And today I just wanted to share with you some tips on how to alleviate pain, especially after a car accident. Because normally after a car accident, we sustain whiplash type of injuries. And these have various different types of symptoms. You can have shooting pain, you can have throbbing pain, you can have headaches, neck pain, back pain, a whole series of problems there. And typically, a person may end up going to the emergency room. They may go see a primary doctor to help alleviate the pain, or they may try some home remedies, which may include heat packs, hot bath, and a popular thing that people do is warm bath with Epsom salt. Other things that they do is anything out of the medicine cabinet. They may try to take Tylenol, ibuprofen, goodies, or some just do nothing at all. They're not exactly sure what to do. Um, so today I'm going to go over a formula. Basically, relief equals prices, and prices is an acronym that I'm going to use to hopefully make it easier for everyone to understand and can use when you're in pain. Okay. So let's start with the first one here. The first one is P, and it equals pain pills. It stands for pain pills here. And if you did go to the ER or primary care physician, they would more than likely have prescribed some type of medication. Especially after an accident, whiplash injuries, they'll give muscle relaxers or any type of pain relieving medication or some inflammatory medication. Um, or they'll try, over the counter, as I mentioned earlier, you have your Advil, you have your Tylenol, you have your Aleve, you have your Goodies powder. One is, I don't think, better than the other. I will say, just take whichever one that you're used to taking. Again, one is not better than the other. And some will tend to take some type of natural supplement. And these supplements can be turmeric. Turmeric is something that's pretty common these days, and others have various other supplements that they take. And some will take omega-3 fish oil or vitamin D, to help minimize any type of degeneration or helps keep the joint healthy. So, any host of those things, of those medication can certainly help. So definitely take your pain pills. You may not hear that often from chiropractor, but I say take whatever is going to make you feel better here. Okay. Next is R for rest. And what I mean by this is you have to kind of do a little bit of different things. You have to sit a little bit, you have to stand a little bit, you have to walk around a little bit. You just can't do one thing for an extended period of time. And this especially includes sitting on the couch. You don't want to just sit on the couch all day because it's painful for you to move. You cannot do that. Don't lay in your bed, all day. That's definitely not going to help. So you got to get up, move around a little bit, then you can come back and lay down on the bed or on the couch. But you just don't want to sit around and not do anything. What I mean by rest is get up and move around a little bit there. Okay, sit a little bit, stand a little bit. Um, just change it up a little bit. That certainly help. Next is I for ice, and do not use heat. Many people, especially my patients, will come in and they'll use heat, and heat is definitely not helpful in cases of whiplash injuries because you're going to have increased levels of swelling, increased levels of inflammation, and then just applying that heat will definitely increase the amount of swelling and inflammation to the injured area. So definitely do not use heat. It may feel good to use the heat pack or sit in a hot tub, but do not do it. It'll definitely slow down your recovery. So make sure you don't do it. I prefer ice method. And all you want to do is just take an ice pack, wrap it around a thin layer of clothing or a paper towel or something. Just place it on the injured area, the area that you're having pain, for about 15 minutes. And for severe injuries, you want to probably do this every 2 to 4 hours. If you have more mild to moderate type of injury, pain-wise, then you want to do it 15 minutes every 4 to 6 hours. And you see athletes do this a lot, after an injury or when they're done participating in their sporting event, they'll keep an ice pack on because it'll definitely reduce the pain level and allow for a faster recovery. Next is C for compress. What you want to do, this doesn't apply to the neck. This is more for your back and your arms and legs, or your wrists, ankles, knees. Okay. And what you want to do, especially for your back, you want to put on a back brace. This will help to stabilize your back, prevent increase in pain, helps your posture, allows you to move a little bit better. Same thing applies to your, if you had knee pain or wrist pain, you want to wrap an arm brace or wrist brace or a knee brace around those areas to help stabilize it, and that compression will allow, to pain to alleviate a little bit as well. You can also use other things such as ACE bandage, or you can get kinesio tape. Kinesio tape is pretty popular right now, where a lot of athletes will tape it around their muscles or joints, which helps to allows them to function better and helps to alleviate pain and swelling as well. And that can also be purchased in drugstores or maybe even Walmart, so that can certainly help. E is for exercise, and what I mean by exercise is you want to stretch, walk, do basic yoga, and this really comes down to light activity. I think too many times people are not doing enough activity after an injury. Again, it kind of goes back to the rest. People just kind of sit around or lay around and not really do too much, but you have to create movement. Movement is what's going to help you recover faster, prevent any type of scar tissue or any type of degeneration forming around the injured area. So you want to move a little bit. Now, I don't mean going to the gym and start lifting weights or anything like that. It has to be very light activity here. Okay. And the last one here is S equals stop. And what I mean by this is if anything that causes an increase of pain, or it causes pain to your neck, your back, your joints, stop doing it. Especially after an injury, you don't want to force anything. You don't want to have to do anything that you don't have to do. So if it causes pain, if standing and walking causes pain, certainly stop. Do not do it, because you can definitely have more injury to the area, more damage to the area, especially if you're not sure what your diagnosis is. So if it causes an increase in pain, stop. Next is, how long should you use this home therapy, which we'll term prices here. As long as you're getting better. Now, if after about 3 days or so, or maybe even after a couple of days, you feel that your pain is worsening or you're not improving, certainly you'll definitely should get medical help. You need to seek professional help, because who knows? You can definitely have something severe. You never know with these whiplash type of injuries. You can certainly have significant injuries that you're not even aware of there. So, and lastly, if you're not sure where to turn to, you could certainly come in for a 15-minute injury management consultation. And and if you can't come in, if you're immobilized, you can't move, you can certainly call and schedule with my assistant Jody. I'll get on the phone with you and see if I can help you out. And it's easy to do. Just click on the link that I have below. We'll talk. We'll go over how the injury occurred. The type of pain, type of symptoms that you do have, any other questions that you may have. Certainly, my patients have questions regarding insurance, attorneys, and all other things of those matter there. So certainly, give me a call, or schedule an appointment for a 15-minute injury management consultation. And this is free. It's no charge to you, but I certainly would like to keep it to a 15-minute maximum time here, and I'll try to be truthful and honest answer your questions as honestly as I can. So, all right. So if you have any questions, click the link below, shoot me an email, or give me a call. Thanks so much for listening.